Hey, everybody. So today we wanted to talk a little bit about AI, which shouldn't be surprising because everybody wants to talk about AI. But we wanted to talk about a very specific use of a very powerful technology as we think a little bit more about how powerful tech can actually advance and kind of be in context of things that help people. I grew up in a family of doctors and scientists. Some of you know this. My grandfather and my great uncle both had Nobel Prizes. My parents were both senior doctors. And so I spent my whole life surrounded by the healthcare system, hospitals, and medicine. And a few things are very clear to me and to folks in my family. Number one, medicine and the healthcare system are just huge. They're huge in every dimension. They impact everybody's lives, and everybody's going to come up into contact with the healthcare system in some way, many times throughout their lives. You know, depending on how you count it, it's a quarter of the U.S. economy. It's one of $4 transacted in America or in this space. So it's enormous, and the stakes are high. You can't make mistakes, and many mistakes are made. And doctors are brilliant. I mean, my folks, my grandfather, incredible humans, but they're still people. And the amount of data that's being generated by the healthcare industry, by pharmaceutical companies, and just generally by research is so overwhelming and moving so quickly now and growing by leaps and bounds that it is leaving individual humans, no matter how brilliant they may be, behind. And so to me, and this is an interest that started years ago, not just recently in the AI craze, it became clear that large language models and AI could be really useful. But also not in such a way necessarily as to replace physicians, but maybe in the way that, Dr. McCoy on Star Trek has a tricorder and is never without it. I think we're going to have tech-enabled doctors and tech-enabled healthcare systems going forward. But in order to do that, the AI just can't be like ChatGPT that we're asking medical questions to. There's just too much potential for error. There's hallucinations, as they call it, and ChatGPT and its ilk don't know whether they're right or wrong. But when it's, you're asking about the history of the monarchy in England, that's fine. If you're talking about a cancer, it's not okay. It has to be without error, and it has to be very credible. And so you're walking down the way of a very specialized AI that's custom built to very specifically answer very delicate questions of medicine. And so it leads you to why you would apply this to the healthcare system. So of course, number one, you have really what amounts to essentially a Tower of Babel. It's an enormous amount of information. It's coded in ontologies that are not only specific to various disciplines of medicine, or a cardiologist versus a nutritionist versus a surgeon versus an imaging specialist, but also specific to certain healthcare systems, hospitals, or pharmaceutical companies. Pfizer and J&J might refer to a patient outcome in two different ways, and they're talking about the same thing. So how do we parse that information and make it useful for researchers, for physicians, for healthcare professionals? So that's really important, this Tower of Babel of data, and the fact that the corpus of that data is growing so exponentially all the time. Another really important part of this is data and AI in particular are really good at picking out the linkages between weak signals. And if you know anything about the history of science, weak signals have led to incredible discoveries. A lot of the biggest things from penicillin to drugs we use today have been discovered kind of by mistake. And AI is really good at saying, whoa, you haven't seen the correlation between these two very disparate things in this enterprise, but you should look at that correlation and maybe that's significant. And indeed in science, many times it is. Equally important, by the way, is danger, right? You can have a prescription for a medication that might be the right prescription for a patient, but unless people are aware of the fact that they're also on another drug that has a terrible interaction, then you might be in a situation where, unfortunately, you've got the right prescription, but a very bad outcome for the patient. And AI will be a great assistant to physicians and to healthcare systems to avoid that situation. It's also going to be helping the payers get incredibly important information out of the populations that they cover. Right now, I remember when I was injured about a decade ago, I realized that recovering from my knee surgery, nobody in the healthcare system knew whether I got better or not. The doctor had followed up a few times. They move on to the next thing. That's what the surgeons do. The payer had paid for my health care, but was unaware of whether I could walk. And so here I was, the beneficiary of cutting edge medical work and payments through the systems that we have here in this country. And no one actually knew whether the consumer, myself in this case, actually got better. So I think AI is going to be helpful in making us better able to learn from outcomes. And then last but not least, if we're able to do this properly, if we can sort through the Tower of Babel, avoid dangers and interactions, get better discoveries and more resilient science from weak signals, and improve the efficiency of the system, we will save money in the most unbelievably expensive and just Byzantine system that is so vital to our lives every day. So is AI and large language models and all that exciting in general? Yes. Is it exciting specifically related to healthcare? Even more so, for reasons that I think are very promising.